Well, welcome everyone, and thank you for joining us for today's webinar. We're really excited to share our project findings with you. Next slide. This project has been a collaboration between the University of Connecticut's Rudd Center for Food Policy and Health, the Public Health Law Center, Healthy Food America, and the University of Washington School of Public Health. Again, I'm Susan Wiseman. I'm a senior staff attorney at the Public Health Law Center. And in addition to myself, the other principal collaborators on this project have been Sally Mancini, who's the director of advocacy resources at the University of Connecticut's Rudd Center, Jim Krieger, who's the executive director of Healthy Food America and a professor at the University of Washington School of Public Health, and Jamie Wallace, who is working on her PhD at the School of Public Health at the University of Washington. Many others have contributed to this project, and we thank them all for their valuable contributions, including research assistants, project advisors, and people who we interviewed as part of the project. And we also would like to take this opportunity to thank Healthy Eating Research, a project of the Robert Wood Johnson Foundation, for their generous support of this project. And then again, just a reminder to put your questions in the Q&A tab. We'll be tracking them during the webinar, and we'll respond to as many as possible at the discussion section, in the discussion section. And with that, I'll hand it off to Jim. Thanks.
Great, thanks, Susan. Good morning or afternoon, everybody. It's great to be here with you today. And we're excited to share what we've learned about designing sweetened beverage taxes that include strong dedication allocation provisions that advance equity. So before we get started, here's a little outline of where we're headed during our time together. Start off with a brief update of the current status of taxes in the US. We'll describe how we developed our recommendations, and then we'll move on to what we learned through that process and through reviewing legislation, through discussions with advocates and policymakers, through reviewing other excise taxes like tobacco, cannabis, and alcohol, and a legal analysis of some of the issues around dedication and allocation. We'll include our recommendations, and then we'll have time, as Susan mentioned, for some discussion at the end. The full report of our project and a brief will be available later this month on the Healthy Food America website, and we'll send out an announcement when the full report is available. Next slide, please. So in the US today, 9 jurisdictions have adopted sweetened beverage taxes, including 8 local governments and 1 tribal nation. 1 has subsequently been repealed. The first tax, though, was implemented in Berkeley, it seems a long time ago now, in 2015. And at the state level, more than 40 bills have been proposed in at least 18 states since 2012. None yet have been adopted, however. Next slide. While no new taxes have passed in the US for the past couple of years, around the world there's strong momentum with more and more taxes being adopted each year, 50+ jurisdictions and growing. Next slide. So a quick review about why tax sweetened beverages, because this helped guide the questions we asked during our project here. So the one primary reason is that by taxing these beverages, you can improve health by reducing sales, purchases, and consumption of an unhealthy product that's linked to diabetes and heart disease and other conditions. The second is that the taxes generate revenues to address needs of priority communities. And what we mean by priority community here, for the purposes of our discussion today, is a community that experiences health inequities, particularly in those conditions that are associated with sweetened beverages and that are disproportionately affected by marketing and consumption of sweetened beverages. And finally, we view taxes as potentially a mechanism to advance equity in and of itself. And here we define equity as fairness in process and outcomes that's achieved when everyone has a fair and just opportunity to participate and thrive, regardless of race, identity, economic class, or other group characteristics. And we'll go into more detail about each of these rationales, but I just wanted to set the stage for that. Next slide, please. So to the first point about taxes decreasing demand or sales and consumption and purchases, the evidence that taxes work to decrease demand is strong, and it's growing, and it's supported by a large number of studies both in the US and globally. Lisa Powell and her colleagues at UIC recently summarized the US studies in a meta-analysis. And pooling data across all the US studies, they showed that demand, most commonly measured by sales and purchases, dropped 20% across the board after tax implementation. The higher the tax rate, the greater the decrease in demand. They also found that for every 10% increase in price, demand dropped by about 15%. And while this was somewhat diminished by cross-border shopping when people leave the tax jurisdiction to try to find untaxed products elsewhere, even after accounting for that, taxes resulted in a 15% decrease in demand. Next slide. And here's an example of what happens when you look at one city over time to see the impact on sales. This is Philadelphia, for example. And immediately after the tax goes into effect in the red line, which is Philly, sales drop. And they drop by 38% reduction, even after taking into account cross-border shopping, compared to Baltimore, which is the yellow line, where there really was no change. That was the comparison city. And while there was a slight bump in the border communities right around Philadelphia in purple, again, it didn't diminish a strong tax effect. Next slide. In terms of the other desired outcome of improving health, the data are just beginning to come in. Mexico is one of the first nations to adopt a substantial sugary drink tax back in 2014. And some studies are coming out recently from Mexico. And the first one, looking at overweight or obese among adolescents in Mexico, if you look at the top line there in that chart on the left, among cities where taxes resulted in the price going up by at least 10%, there was a significant decline in the rate of overweight and obesity after the tax among adolescent girls. On the right side, it looks at what happens with oral health, with cavities. And with that line in the middle is when the tax went into effect. And immediately after the tax went into effect, they were able to pick up a decrease in the number of teeth with cavities in both kids, as shown in this slide, and among adults. Next slide. The second reason for adopting taxes, and often a primary motivator for policymakers and advocates, that taxes raise revenues that can be used to address community needs and priorities. In the US, taxes are raising about $135 million a year across all the sites that have them. And the biggest investments are in human and community capital. And these fund early childhood development programs, community infrastructure, improvements, say, to parks and rec centers and libraries, and youth and workforce development. Health-related investments are the other big focus, and they primarily, the biggest category is access to healthy foods and beverages, but also support for physical activity, for mental and social and physical health and well-being, for health and nutrition education, for chronic disease management and prevention, and so on. Next slide. The third reason for adopting taxes is they can, if they're properly designed, advance equity. And this slide shows some considerations for centering sweetened beverage taxes in equity. These were developed by the Tax Equity Work Group, which was a set of experts who were both advocates and policymakers from various sectors who got together to think this through a couple of years ago. This report, if you're interested, is available on the Healthy Food America website. A well-designed tax can promote health and social equity by benefiting the people most harmed by the beverage industry's sugary drink products and by their predatory marketing practices. It invests the revenues in these impacted communities and gives them a strong role in deciding how to use the revenues. Because dedication and allocation provisions of tax legislation are powerful tools to make this happen, that's why we chose to look into this in more detail for this project. Next page. So currently, investments of local tax revenues aren't primarily going to impacted communities. If you look at this in the green bar here, it shows that across all cities, about 85% of revenues are going to either communities of color or low-income communities, with some variation across the different cities across the US. Next slide. But there's no guarantee that taxes revenues will be invested as promised. And we've seen this in a couple of places. In Seattle, for example, the mayor tried to divert the revenues to uses other than what was intended by the purpose of the legislation, which prompted advocates to ask the council to take action. And the city council did indeed take action by overriding the mayor and passing subsequent legislation to set up a special fund to put the revenues into, and being with very clear parameters about how those revenues could be used. Similar attempts at diversion have been observed in Oakland as well. So it's important, as you'll hear, to design legislation to try to prevent this from happening. Next slide. So here's then an overview of the 5 areas in which we think tax policy can be designed to effectively allocate and dedicate revenues for these purposes. The most widely used mechanism is tax revenue dedication. And dedication is a budget practice that assures that a portion or all of a tax's revenue will be used for specific purposes as identified in legislative intent. And you'll hear a lot more about that. This is also called earmarking, is another common term for that. Legislation can also express intentions as to how the revenues could be used and describe the benefits of the tax that are anticipated. So that sets out important parameters for the tax. It can also include requirements for how revenue gets allocated, and also for monitoring the receipt of tax revenues and how tax revenues are spent, and also processes for including community voices and including community oversight of tax implementation. So our report discussion today will describe the diverse approaches used by sweetened beverage tax legislation to direct revenues to intended purposes. We'll talk again about how other types of excise taxes, like on tobacco, alcohol, and cannabis, have done this. And we'll give you our recommendations for how to draft legislation to be effective in making sure that revenues are used as intended. So now I'm going to turn it over to Jamie, and she's going to share the methods that we've used to develop our report. And then we'll move into discussion of each of these 5 boxes or mechanisms for assuring that revenues get used as intended. So off to you, Jamie.
Great, thanks, Jim. So as Jim mentioned, I'm now going to talk about the methods and the data collection for the information presented in today's webinar. And so we reviewed 3 main data sources, the proposed and enacted legislation, lessons learned from other excise taxes, and then we conducted semi-structured interviews. And so we sought to collect all proposed or adopted sweetened beverage tax legislation in the US since 2012. And because some states had brought forth many similar bills over the past 10 years, we kept only the 5 most recent bills per jurisdiction and ultimately selected 43 bills from 18 states and 12 proposed or enacted bills from 11 cities. And we opted to exclude the bill from the Navajo Nation from these analyses because it taxes unhealthy foods more broadly and it's not focused on sweetened beverages. And links to each of these bills are available in the appendix of the final report, which will circulate following. And each piece of legislation was coded independently by 2 student researchers using a structured coding guide, and then met to resolve discrepancies, and relevant pieces of the legislation were extracted for review. And we analyzed each bill in 2 different ways, both at the jurisdictional level and at the legislation level. So at the jurisdictional level, a jurisdiction was considered as having a given element if it appeared in at least 1 piece of legislation from that jurisdiction. So for example, if a state had 5 bills proposed and at least 1 included intent to center equity, that state would be included as including an equity intent. And we additionally summarized state and local bills separately because considerations differ by the jurisdictional level. And state bills thus far are all proposed but not adopted, while many of the local legislation have been adopted and implemented. Next slide, please. We next examined the literature around alcohol, cannabis, and tobacco excise taxes since 2000. And a student research assistant and a senior researcher reviewed the peer-reviewed journal articles, state laws, policy papers, and commentaries, and then summarized those findings for both the webinar and our final report. Next slide, please. And then finally, we conducted group interviews with policymakers and advocates at the state and local level, and identified jurisdictions through conversations with advocacy groups to find sites that could provide a varied insight into tax dedication allocation practices during the adoption and implementation phases. Our interviews lasted approximately 30 minutes and were led by an experienced facilitator, and we included questions about approaches, obstacles, successes, and lessons learned during the drafting, adoption, and implementation stages of tax revenue dedication allocation, and the ways in which jurisdictions can advance equity. And then we coded transcripts and deduced and identified key themes. So I'll now pass it off to Susan.
Thanks, Jamie. So I'm going to talk about embedding equity intent in legislation. Go on to the next slide. When we interviewed advocates and policymakers, we heard across the board that explicitly emphasizing equity intent as a key purpose and goal of the legislation is critical to ensure that it will truly function as a tool for advancing health equity and racial and social justice. So Jim talked a little bit about centering equity theoretically, and I'm going to talk about it from a practical standpoint. Centering equity is a key purpose of the legislation. This helps to ensure that the tax revenues will benefit communities experiencing the highest levels of inequities and rates of chronic disease. Calling out equity means naming the specific types of equity impact issues and identifying the communities that should be prioritized through investments of the tax proceeds. Calling out equity also builds diverse support for passing and implementing the legislation, and it ties equity intent to the implementation steps by committing the government to invest the tax revenues in ways that address equity concerns. It gives communities tools to hold the government accountable and sustain focus on equitable allocations and outcomes by building in accountability measures, including ongoing community input and guidance. Emphasizing equity as a cornerstone purpose also counters misleading claims made by the beverage industry that these taxes are regressive and unfair to people with lower incomes and people of color. Next slide. One of the most important messages we heard from people we interviewed is that equity is as much about the process of enacting legislation as it is about the words on the page. So emphasizing community participation should be front and center throughout the entire process of developing, implementing, monitoring, and reporting on legislation. Next slide. In our review of proposed and enacted legislation, we found that slightly more than half of all states that have considered this type of legislation have included an equity intent in at least one bill, and that the majority of all local governments and all local policies have included an equity intent. Equity intent was expressed by a much higher percentage of all local governments and in a much higher percentage of local policies. Next slide. In looking at types of equity prioritized, we found that health equity was mentioned most often and with high frequency among state and state bills. Nearly all local jurisdictions and policies addressed health equity. Racial equity was mentioned in half of the states and in half of all the state bills with equity intent. And racial and economic equity were mentioned more frequently at the local level. Among state bills with an equity intent, a little less than half of them addressed multiple types of equity intent. These types were addressed more frequently at the local level. Next slide. Looking at which communities are prioritized, we found that nearly all states and state bills with an equity intent addressed multiple priority communities. Those mentioned most often were children, people of color, low-income communities, and high-burden communities. A few states and bills addressed other priority communities, including Medicaid enrollees and preschoolers. Nearly all local governments and policies identified at least one priority community. We also looked, next slide, at lessons learned from alcohol, tobacco, and cannabis legislation. And found that alcohol and tobacco excise taxes do not explicitly state an equity intent. These are older types of excise taxes that were initially justified as a means of generating revenue for states' general funds. So although all 50 states have alcohol and tobacco taxes, many states do not do a great job of dedicating or allocating portions to health equity purposes. Many states do dedicate a portion of tax revenues to support alcohol and tobacco-related education, prevention, and cessation programs, but they do not specifically call out equity intent. We did find two recent bills that sought to dedicate revenues for equity purposes, one for alcohol and one for tobacco. So there is some positive movement in this direction. Recreational cannabis taxes are increasingly being modeled on tobacco tax provisions that require an evidence-based prevention and control approach aimed at changing social norms and reducing use. And 4 states are actually spending a portion of their cannabis tax revenues for equity purposes, including restorative justice and social service programs to address the needs of communities that have been disproportionately impacted by the policing of the war on drugs. Next slide. So to sum up, Based on our review of legislation and other excise taxes, as well as conversations with advocates and policymakers, we recommend that sugar sweetened beverage tax legislation explicitly state equity intent as a key purpose, include findings showing disproportionate impacts, describe the equity impacts that the legislation is intended to address, identify priority communities and commit to investing the tax revenues to benefit those communities, and build equity intent into other key parts of the legislation to ensure that the revenues will be applied to advance equity aims. We also recommend including other purposes and goals in the legislation, and that a portion of the tax revenues be dedicated to those additional means of benefiting prioritized communities, such as investments in chronic disease prevention and treatment, health promotion, oral health, safe drinking water, and strengthening infrastructure, just to name a few. These investments can help build support for enactment of SSB tax legislation. And then finally, on the next slide, in this example of equity intent language from Boulder, Colorado's ordinance, the legislative intent is embedded further into the legislation. It's not upfront as a statement of purpose. We don't have a great example of enacted legislation that conforms to our recommendation to address equity as a statement of purpose. And this is an aspect of legislation where improvement is needed. We recognize that not all jurisdictions include statements of purpose as part of their final legislation. And for this reason, we recommend as a general practice that equity intent be addressed in testimony or written submission during the hearing process so that it is made an official part of the record. And with that, I'd like to thank you for listening, and I welcome any questions and comments during the discussion section, and I'll hand this off to Sally Mancini.
Great, thanks, Susan. I'm going to now talk about tax revenue dedication. And we define dedication as the process used to restrict use of tax revenues to specific purposes, such as those identified through legislative intent. Earmarking is another commonly used term for dedication. Next slide. So we analyze dedication in state and local policies. Depositing revenues in a special fund separate from the general fund or general budget fund was the most common dedication mechanism. We found that among local bills, only 42% dedicated revenue using a special fund. This is primarily because in California cities, which comprise the majority of these bills, in order to dedicate revenue, a tax ballot measure must pass by at least 2/3 of votes cast. Because of this high threshold, no California city has included a dedication provision in a proposed tax measure. When it comes to the proposed state bills, 91% of the bills that we analyzed dedicated revenue using a special fund apart from the general fund. Most created a new fund and some used existing funds. And for alcohol and tobacco taxes, approximately 1/2 of states dedicate at least a portion of revenues to specific purposes. Some states with these excise taxes have used special funds for revenue dedication, and policy researchers caution that state budgets tend to absorb funds that are not earmarked for specific purposes. Next slide. We also looked at supplantation. Supplantation is a budget maneuver that can be used by policymakers to work around dedication provisions. It refers to the use of a new source of funds to substitute for funds allocated to an existing program or activity, thus freeing up the general funds directed to those programs to use for other purposes. We found that 8 states have proposed at least one bill with non-supplantation language, which prohibits using the sugary or sweetened beverage taxes revenues to fund current operations and requires use only for new or expanded programs. And at the local level, the Seattle City Council created a special fund with non-supplantation language in a follow-up ordinance in response to an attempt by the mayor to use tax revenues to supplant general funds. And Jim had touched on this earlier in the presentation. Given the attempts to use tax revenue for other purposes, our project recommends specifically including non-supplantation language in the policy. So what did we learn from the field? Interviewees shared a strong desire that sweetened beverage tax revenues be dedicated and spent for specific purposes. All but one of the state level interviews recommended a dedicated special fund as the best way to ensure this happens. And we learned from a city level advocate that once the city's sweetened beverage related tax revenues are dedicated, they are not tapped for anything else. We also learned that dedication provides a foundation for accountability, ensuring that tax revenues are kept and used as promised. Honoring commitments for how revenues are used builds trust between community and government. And when dedication is not included in legislation, like in the California cities just mentioned, advocates, elected officials, and community members have made use of political processes to try to ensure that revenues are invested as intended. And then finally, a few interviewees noted potential tensions between legislators wanting the flexibility to move funds where they see fit from year to year, and policy advocates wanting to ensure stable, long-term funding that is responsive to express community needs. Depending on the political context of a particular jurisdiction, it may be judicious to place revenue in the general fund and designate a line item or use an existing special fund. Next slide. So based on our work, we recommend establishing a special budget fund for deposit of revenues dedicated to specific purposes. This is an effective mechanism, but still, given budget shortfalls, it can be raided or repealed by legislators. Second, clearly describing the allowable uses of tax revenues deposited in the special fund, consistent with legislatively expressed equity intent, is very important to ensure dedication. And then thirdly, including the non-supplementation language helps ensure that funds are used as expressed in the intent of the bill and existing programs or creation of new programs, and prohibits the backfill of other appropriations. Next slide. So we have included example language from bill text here in the slide deck, and we'll circulate the slides after the webinar for reference. Next slide. So now I'm going to touch on how tax revenues are allocated, for what purposes, to which communities, to which organizations. And this is because tax allocation practices have a major influence on support for a tax and the extent to which it addresses equity and its impacts. Next slide. So we heard loud and clear from those that we interviewed that explicitly emphasizing the equity intent of the legislation is critical, and that it must be tied to addressing priority communities through the use of the tax proceeds. From one local advocate, we heard there's a 0% chance that a piece of legislation like this has community acceptability without clearly defining how the funding is allocated, period. Next slide. So we also heard that allocation targets are shaped by the context, values, and priorities of each jurisdiction. For example, interest in this tax in one state originated from advocates seeking funding for snack program nutrition incentives. In a local policy, the initial council champion saw the tax as a source of funds for early childhood programs, but the priority shifted to healthy food access when community advocates expressed their priorities. Second, clearly describing how funds will be used is essential. It builds support, especially from those who stand to benefit from the allocations. On the one hand, avoiding overspecification of allocation targets in legislation gives more latitude during tax implementation for community members, advocates, and legislators to shape allocation targets and address changing community needs and priorities. On the other hand, specifying the allocation targets to some degree promotes legislative and executive accountability to intentions expressed during the tax policy adoption. And finally, interviewees offered some innovative approaches to allocation. One city is considering allocating revenue to support organizations engaging in advocacy aimed at policy change. Its advisory board, assisted by city staff, has developed definitions of equity to guide allocations and developed tax impact measures centered in equity. And a state shared the idea of allocating revenue to each city in proportion to the amount of revenue it generates. Next slide. When we analyzed the SBT policies at the state level, we saw that tax legislation varies considerably in how specifically it describes allocation purposes and processes and in the types of programs and activities they authorize. Most legislation directs funding to multiple target areas. So for the state bills, we found 46 types of programs and activities. The most common were community access to food and nutrition, chronic disease prevention and treatment, incentives for subsidizing purchase of fruits and vegetables, and school nutrition programs. Next slide. At the local level, we found 12 types of programs and activities. The most common were community access to food and nutrition, including healthy food access programs such as subsidies, meal programs, and food banks, and improving the quality of school food through farm to school, funds to purchase fruits and vegetables, et cetera. And we also found revenues invested in chronic disease prevention and treatment. Next slide. So based on our work, we recommend the following for allocation: to describe the programs and communities that will benefit from these allocations in legislation. And then allocation of revenues is guided by legislative intent. So including equity as an intent is an important mechanism to ensure that the programs and activities funded by tax revenue focus on priority communities. It's a way to connect the dots between the legislative intent and the allocation targets. And finally, allocate revenues to support priority communities and reflect community values. Next slide. Again, we have example language of allocation consistent with our recommendations in the slide deck that we will be sharing. And now I'm going to turn it over to Jim.
Great, thanks, Sally. So we've already heard from all of our speakers so far about the importance of community participation in implementing taxes. So including provisions in legislation that formalize this community participation is another core element for making a tax policy progressive. The most common mechanism that we observed, as I'll show, is using advisory boards to include people from priority communities in the process. So if we are looking at the tax legislation that we reviewed, first looking at the local ones, about half of them, and it's pretty similar for states, included advisory boards. The advisory boards can help ensure that people from priority communities and other interested parties as well play a role in guiding revenue allocation and also play a role in monitoring the implementation of the legislation. When we talked with our interviewees, they saw advisory boards as a particularly effective participation mechanism. Although in some cases they pointed out that advisory boards weren't always politically feasible or didn't have a very good track record in certain communities and so were less desirable. People from the priority communities, if they can get on advisory boards, they bring their lived experience that's invaluable in guiding the allocations, that they really address the priorities and are in sync with the values of those communities. The other also interested parties also have been nominated to advisory board positions, and they tend to be representatives of organizations or individuals whose work is closely tied to the tax intent and to the revenue allocation targets. So they bring knowledge and experience about implementing programs in those areas. The current advisory boards are all local because that's where we have them in play. Developing state level advisory boards will require adapting and innovation on this local model. States are bigger, representing geographic diversity across the state, and addressing some of the logistics about convening the board are going to be challenges, but they can all be overcome. And it's interesting to note that advisory boards are an innovative provision for sweetened beverage taxes. They're not commonly found in other types of taxes we looked at, like alcohol, tobacco, or cannabis. Next slide. So the membership criteria for these boards varied across states and localities, and this reflected in part the differences in the programs and sectors that are identified in legislative intent and targeted for revenue allocation. The state boards, because of the way they chose to allocate revenues, often included people from the health sectors, whereas local boards frequently included people from the school sector, early childhood, or people working in food security. While slightly more than half of the advisory boards did include community members, they nearly always constituted a small minority of the board, and this is a potential weakness of current approaches that should be addressed in future legislation. Some interviewees held that advisory board members even should be exclusively or primarily people with lived experience, or at least people on the front lines providing services funded by the tax to priority communities. However, others noted that it's important to include people with recognized professional expertise related to the tax intent and allocation targets. Next slide. The legislation specified multiple roles for advisory boards. All the state boards and most local ones made recommendations about allocation of the revenues, what type of programs, where they should go, who should get funded in general. Other common roles are monitoring and reporting on tax implementation, which I'll come to next in more detail, and also advising on how taxes, the impacts of taxes should be evaluated. As one advocate said, an advisory board holds the city accountable via organizing and political power. And we've been able to make sure that funding continues to be invested as originally intended. And I think that gets to the point that in addition to the formal powers and roles of advisory boards, the advisory boards have also had informal political power because they have credibility with local and state officials to and who want to honor the insights and wishes of these boards. Next slide. So what we recommend is that legislation establish an advisory board and that it be explicit in who it names to the board. The members include community members and potentially as a majority or supermajority of the positions, but that also people with subject matter expertise are either included as board members or as expert advisors to the board. And that there's clear specification of the members' roles, particularly with respect to revenue allocation and monitoring tax implementation. Next slide. So here's an example of language from Washington State from 2021 that's consistent with these recommendations. And this highlights include that the board will play a role in revenue allocations, particularly addressing social determinants of health, that the board will participate in grant reviews to allocate revenues from the tax, and it also includes diverse membership, as well as giving the board a role in producing an annual report about how the tax is working out. Next slide. So finally, we looked at monitoring and reporting provisions of bills because monitoring and reporting results in sharing important information about how tax implementation is going, which in turn can assure that the revenues are being used as intended. Next slide. Most legislation has required reporting and monitoring on tax implementation, especially with regards to how much revenue is flowing in from the tax and how those revenues are being allocated, and usually through a public annual report to disseminate the information. From the interviews, we learned that effective reports also include the advisory board's recommendations, if there is one, and how those compare to the actual revenue allocations, again, as an accountability mechanism, and also information about what types of programs are funded with descriptions of the programs, who gets the funding, and how much funding to each program. Including the advisory boards in report preparation and dissemination increases the value of the report as an accountability tool because the board's perceived as an independent body, quote, outside of government, as one of our interviewees told us. And making sure the report's posted publicly, for example, on a city webpage, helps with accountability. Some cities go further and even publish monthly revenues on public web pages, like in Philadelphia or Boulder. Next page. The value of reporting then provides transparency and accountability for tax implementation. It also helps build support for the tax because if people know that their monies are being put to good use, they'll tend to remain supportive of the tax. And it helps communities participate because they have the knowledge to be effective participants in the process of implementing the tax. Turning slightly to a different aspect, about half the policies required an evaluation of tax impacts. And these primarily focus on the impacts on sales, purchases, or consumption, or they call for assessing the health impacts of taxes or the equity impacts of taxes. A few of them also mentioned actual evaluation of the programs funded by the taxes as well, but this was less common. But building in a requirement for evaluation and then funding that through tax revenues is a good way to assure a rigorous assessment of how the tax is working out. Next slide. So we recommend then that there be a public annual report on implementation of tax legislation, and that it includes the points mentioned here, how much money is coming in, how it's allocated and expended, what kind of activities have been funded, and how this contrasts with the advisory board, if there is one, its recommendations for allocations. And then requiring an evaluation of tax impacts is also helpful to both show how the tax is working out, to identify successes, as well as areas for improvement. Here's an example from Rhode Island. It's a bill from the last legislative session that requires reporting on tax revenues received and the programs and initiatives funded by these revenues, and also tracking any unspent funds that are accumulating that from the tax revenues. And then also to complete an evaluation, and then it goes through with 3 points that must be included in the evaluation. Next slide. So finally, to wrap up before we get into our discussion period, I'm just hoping that, on behalf of all of us, that the findings and ideas that we've shared will prove useful in ensuring that sweetened beverage taxes are an effective policy tool so that can advance equity and promote the health of all people. And I wanted to close with some new data that shows that the economic impacts of these taxes may indeed be progressive when the legislation is written with equity in mind, as we've been describing, that they can benefit people with lower incomes to a larger extent than those who have greater resources. Jesse Jones-Smith, colleague at University of Washington, myself and other colleagues just finished a study comparing the economic burden of taxes as well as its benefits for people with higher incomes versus lower incomes. It'll be published later this month in Food Policy. And in this example of what we found in Seattle, the orange bars show how much revenue was contributed by each income group, how much they paid in taxes. And the green shows how much benefits they received from the use of tax revenues, taking into account where the revenues were targeted, to what types of investments, to which people, with higher income people on the left and lower income people on the right. You can see the lower income group paid less and received more benefits, resulting in a net transfer of nearly $9 million from high to low income groups in Seattle, which is the hallmark of a progressive policy. So, and this only happened because the Seattle tax and the other ones that we looked at included many of these provisions to center taxes in equity. So now we're going to transition over and we'll have some time for discussion. So the rest of the panelists will join us and Jamie's going to moderate this. So I'll turn it back to her.
Great, thank you, Jim. And just as a reminder, if you have questions, feel free to put them in the Q&A section and we will cover those as we go. So it looks like a first question that came in is if you could speak a little bit more to how these taxes particularly discourage consumption and kind of the evidence around that.
Great. Yeah, I guess, Jim, you want me to take that one? And
yes, sorry.
Yeah, okay. So the question is, I shared some data on impacts primarily on demand that's measured by sales and purchases. There have been a set of studies that have looked at consumption, but consumption's turned out to be much harder to measure accurately. So these because it's by self-report and people's recall can be difficult, and many of these studies have pretty small sample sizes. So they've generated mixed findings, some showing some decrease in consumption among some subgroups and some showing not much effect on consumption. However, there's been a recent study that looked at a large population sample among adolescents using the YRBS Youth Risk Behavioral Surveillance System and compared Philadelphia to several cities that did not have taxes. This was done by Christina Roberto and her colleagues, and did show a significant decrease in consumption of soda in Philadelphia compared to other cities. So that's the first large-scale population-based study that has shown that. So I think that's consistent with the effects that we've been seeing on purchase and sales.
Great, thank you. All right, so then the next question is, how do you approach the argument that it would be equitable to not tax those who have been disproportionately burdened and leave those dollars in their pockets? And maybe, Jim, if you'd like to take this one again, or
Yeah, I think that's a really important question, and it's come up in many of these discussions across many communities. And I think the answer is that a tax should be implemented and adopted in the community only if people from the impacted community want to see that tax move forward. And we have to leave it for them to make a decision for themselves that it's a benefit to their community. So if they decide that it's worth putting this tax into effect because it's going to bring revenues that are going to be invested in their communities for purposes that they think are valuable, then it seems like it's reasonable to move forward. And indeed, none of these taxes politically can move forward very effectively unless they have support of the impacted communities to make that happen. So I think that's a built-in kind of check and balance. And as I showed in that last slide, the taxes seem to have the net impact of transferring dollars and resources from better off people and communities to lower income communities. So if it's understood that there's going to be actually more resources available, then people from those communities tend to think it's worth doing. It's also worth pointing out that the absolute amount of tax that's paid by household is very small per year. It's, you know, in the range of $15 to $20 per household per year on a per capita basis. And so that's a small amount and a very small proportion of total household income. So it's not a big hit on the household budget. I'm just,
Yeah.
if panelists might want to add more too, I think.
Yeah, sure. I'll just chime in. We interviewed a number of cities who have passed tax legislation, and we heard about very extensive grassroots participation by cities, including listening sessions, community organizing, and door knocking around these taxes. So for the taxes that have been passed at the local level, there has been a significant participation by priority communities in the process of passing the legislation. I think the challenge is moving on to state level legislation and figuring out how to better incorporate equity in the process of equity and all the things that Jim just mentioned into state level legislation, and scaling up to state level is going to take more time and effort, and I think more extensive planning and understanding what's happening around the state, not just in one community.
Great. Thank you. Sally, maybe this one can be directed towards you. If you can speak a little bit to the California provision specifically that prevents local city and county's current ability to pass a new tax. If you could just talk a little bit more about that and how that affects our findings of those cities.
Yeah, so we did not interview any policymakers specifically about that piece of legislation. And Jim would probably have a little bit more to share on the current state of affairs in California. We specifically talked to legislators about a state of Connecticut or state of California tax, so a state level tax, not about the bill that preempts other local jurisdictions from passing an SBT tax. So Jim, do you want to chime in there?
Sure, I'll just do that briefly because we've got a lot of interesting questions coming in. So the story in California is that the beverage industry essentially blackmailed the legislature into passing a bill that preempted future local sweetened beverage taxes in California for 12 years. And they did that by threatening to put on the ballot a measure that would have severely hampered the ability of local jurisdictions to raise local taxes, period. What's happened is that was then challenged in court. And the first ruling came down about one provision, which was that it was not permissible to penalize cities by depriving them of all tax revenues if they tried to pass a sugary drink tax. That was the penalty included in the preemption bill passed at the state level. So this still didn't resolve the issue of whether a city could indeed go ahead and pass a tax or not. But now the legal experts in California believe that charter cities in California do have the right to pass taxes. And so what will probably happen in California is a charter city will try to pass a tax. It will pass a tax, and then there will be a legal challenge, which the lawyers think that the city will prevail in being able to keep its tax on the books. And so there are also efforts to try to pass legislation to undo preemption, but those have not moved forward yet.
Great, thank you. All right, so next we have a question about long-term planning suggestions for public health programs that benefit from sweetened beverage taxes or tobacco tax allocations. So if these taxes do indeed reduce demand for the products, revenue will go down as purchases decrease. And this person experienced that themselves on a project that had been funded. How do you suggest that programs plan for these? decreasing revenues.
You know, it's interesting. I'd like to hear more about the Boulder experience, because when you look at revenues in general, and I looked at that just probably 6 months ago, tax revenues actually have been stable over time for 3 or 4 years in places that have had taxes that long. You see a one-time drop in consumption, as I showed in that slide about Philly, and then consumption plateaus or levels out at a pretty stable level after the tax has been imposed, and suggesting that revenues will also remain stable. And that's what overall the revenue collections have looked like in cities. So it seems like there isn't a declining revenue because people just, because of the stable level, lower but stable level of consumption.
Great, thank you. Any additions? All right. Let's see. So we have a next question. Someone was surprised to hear a mention of a simple, surprised to not hear a mention of a simple per capita direct distribution to taxpayers as a progressive revenue allocation option. Can we talk a little bit about why that option was not considered or recommended in this webinar? Jim, would you like to take that one?
Yeah, I'll do that, but I'd love to hear what the other panel members say about that. I think if I understand the question right, it's why not take the revenues and then just refund people in a progressive, using it, you know, to people, predominantly to people with lower incomes, to make it a progressive redistribution and let them spend it however they choose. And that's an interesting option. We didn't find anybody who considered that, and so we didn't make that as a recommendation. But I think that would be interesting to model that out and sort of try to understand what the net benefit with that approach would be relative to investing in these very specific programs that directly target health inequities and invest in other programs and services that are of value to the community and potentially drive more collective and benefit for the common good. Susan, do you have more to add to that? Because you're
no, I agree with what you said. I think that by and large, when people do truly understand the community benefits and the focused effort on addressing disproportionate impacts, that they tend to come along to support the taxation policy. And I haven't seen examples either of this being requested to a large degree, at least.
Sally, another question about kind of if something curious if something came up during any of the interview processes. They're asking about it being important to advance sweetened beverage taxes at both the local and the state level, but kind of the prioritization of one, and specifically whether it came up in the interviews that at the state level, it's easier for the beverage industry to sort of concentrate their efforts and constituents are a bit further away from state policymakers. So did that come up in any of the interviews?
You know, I will say that what we heard from those that we interviewed at the state level was that, yeah, the policy development process was typically, it happened very fast. There wasn't a lot of planning that went into it. And it was usually driven by a legislator who was very interested in the topic and not necessarily from individuals from priority communities or a groundswell of community support. And I think that in addition to beverage industry opposition is a real challenge that we have for passing state level legislation is we haven't seen long-term multi-year funding for state level bills in the way that's needed to combat the industry and build real support. So I'll stop there. Jim may have something to add.
No, I think you summarized it really well, and the question summarized it really well. The industry has much more concentrated power, and we learned this from tobacco as well. I mean, essentially the lead in some of those papers, documents that were revealed from the discovery process during the master settlement agreement, tobacco industry kept saying, we have all our firepower at the state level. We can control the state. We don't have as much influence over local policy development. And so I think the same thing is playing out because they're using the same playbook in sweetened beverage taxes.
Great. And then I guess again for Sally, so there's a question about when conducting interviews, were interviewees able to share information about how funds were being supplanted in different communities. They share, for example, that in Oakland, up to 70–80% of the tax has been used to supplant. Did any of that information come through during the interviews?
So we did not interview anyone from Oakland. We had heard that this was happening and knew that it was an issue. So we did hear about it a bit from Seattle when we spoke with folks there. But given what we knew was happening in local jurisdictions, we felt it was very important to talk about supplantation and including non-supplantation language in future tax legislation.
I noticed Molly from Oakland put a note in the chat saying advocates are working on this in Oakland, ! So getting the money back to impacted communities, but we're still in the organizing phase. So go Oakland and hope you're successful with that.
Yes. Yes, I completely agree. Go Oakland.
Okay, about 1 more minute left. Let's see, I wonder if Jim, if you could speak to representation of on the advisory boards from local businesses, specifically around criticism from local business owners that sweetened beverage taxes might harm their sales, and if they're represented on the advisory boards.
Yeah, that's a great question. Some of the state tax bills did include representatives from industry, particularly food retail industry, like stores and grocery stores, that kind of thing. However, the others, I haven't seen that otherwise explicitly mentioned that way. But I think it's a really interesting idea, and I think that's one worth considering.
Great. All right. I suppose we should maybe wrap up there. I think, Stephanie, we might have one last slide with some contact information and some closing information. Thank you all so much for joining us today. If you have any questions, you can feel free to reach out to Jim directly. His email is here, and we'll kind of crowdsource our answers. And then we will send the slides and a link to the recording after this. We will be publishing the full report that came from this project on the Healthy Food America website later this month.